Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to go over neck pain. So I know I talk a lot on this channel about spasticity, and I really I think give the impression that that is the root cause of all movement problems, but there really are a lot of other things that can cause movement problems and also cause pain when you're doing your exercises. Today we're going to focus on the neck and what some of those causes might be that might be causing your neck muscles to become tight or sore or feel like they need a massage after you do exercises or really after you do anything. And then we're going to go through a pretty comprehensive stretching routine for the key muscles around your neck that usually become shortened, and probably a lot of us, just because of the added stress right now and not really moving around as much, they could be flaring up a little bit. So hopefully you'll be able to figure out which muscles are the culprits for you, and you can focus in on just stretching those muscles. But before we dive into all of that, if you're new to my channel and you haven't yet subscribed, go ahead and hit that subscribe button. Turn on that notification bell so that you'll be notified every time I upload new videos. And now let's go ahead and get started. If you know me, you know I'm going to relate this to those of you that have had some type of neurologic injury. So the first thing I think of if you are experiencing neck pain or muscle tightness, or I can feel someone in my clinic that has some trigger points or big knots in their neck muscles, I always go back to their history and kind of their initial hospitalization. And the reason I always go back there is most of you spent a prolonged period of time in certain positions, and so it probably started way back then and just never got addressed with all the other things you were trying to learn. They might have just gotten overlooked. And so we are going to go all the way back to that initial hospitalization and see if you can identify any of these situations that might relate to you, because that'll help you to focus in on the key muscles that might be tight on you. So I hope that all made sense. But there are some key things that a lot of you went through in the hospital or procedures that might have started you down the road of having some shortened neck muscles. And the first one that I can think of is any of you guys that were trached, or they created an airway in your neck. And you would know because you probably have a scar right in the middle of your neck. But that is one thing that doesn't get addressed very often. But if you can feel, if you had a trach and you can feel there's some scar tissue over there, our body is just one big piece of fascia, and all the muscles and everything are really connected to the fascia that covers our entire body. So if there's any tightness there, it will start to shorten those muscles or restrict the elasticity or the mobility in those muscles. So you might experience a little bit of a forward head, forward shoulders, but again, those neck muscles are going to be really tight. One way that you can check to see if that is you, when you tip your head back, if you feel like you can't keep your mouth shut, you feel like you need to open your mouth because it starts to pull on your neck, that might be an indication that some of those muscles on the front of your neck are tight. So if you had a trach, most likely you do have some tightness on the front of your neck and also probably on the front of your shoulders a little bit. The other thing that might cause your neck muscles to become tight that I've seen, and that is any of you that had a craniotomy. And what a craniotomy is where they remove a piece of your skull to relieve some of the pressure. Then once you're medically stable and the pressure's gone down a little bit, they put that piece of your skull back on. A lot of times, because you just have this open, exposed area of your brain that doesn't have any hard protection around it, you avoid it, you don't lay on it. It really does affect the way that you position yourself in bed, or the way that the medical team positions you in bed. But the big thing that I've noticed with people that have had a craniotomy is they really have a lot of tightness on both sides of their neck. So usually in their upper trap. So I'm not really sure why that is, but I think maybe that you're just more guarded during that whole period where you didn't have that piece of your skull on, and then they put that piece of your skull back on. I don't know. The only thing I can think of is that you're just more guarded. So a lot of times you'll have a lot of tightness, or I've noticed in some of my patients, they have a lot of tightness in their upper trap, and it's usually on both sides. So just something to pay attention to. We are going to go into an upper trap stretch. So if that is you, I would try doing that stretch on both sides. So some other things that you might have experienced that aren't really medical procedures, but might cause your neck to be tight, or might cause you to might cause you to have some muscle imbalances around your neck, which will lead to neck pain, is if you have neglect. I'll put a link in the description below. I do an entire video on neglect so that you can see if that is something that you struggle with. But neglect is basically just an inattention to one side. So what happens is you have a tendency to just keep your head turned to the side that you're more aware of most of the time. And so those muscles on that side of your neck will become tight, primarily the sternocleidomastoid. So we will go into that. For short, it's the SCM. We'll go into how to stretch that muscle. And then again, your upper trap, which is a culprit for a lot of people. So those might be some of the muscles that you'll want to focus in on. The other group or category of you that might have some neck pain are those of you that foot propel your wheelchair. So I see this a ton. So some of you, if you don't have use of both of your arms and you're not walking yet, to get around, what you'll do is you'll foot propel with one leg. If you're in that category, you already know that. But what happens is you really have to like scoot your hips forward to reach the ground, or there's just a natural tendency to kind of slide your bottom forward in your chair to reach the ground. And so then what happens is that in order to see where you're going, because that kind of leans you backwards. In order to see where you're going, you have to tip your head down. And I've also found that people like slide that leg forward a little bit, so then you also turn your head a little bit as well. So those of you that foot propel, you will have some tightness in the muscles in the front of your neck. Also maybe a little bit of the muscles that rotate the head as well. So those would be some of the muscles that you would want to focus in on stretching. The other group of you that I think gets forgotten sometimes is to the problems with like neck tightness that you might be having now are those of you that early on you were really sedated or you were really sleepy. It might be hard for you to remember that, but maybe ask a family member or go back and look at pictures and see if you were really sleepy and just kind of out of it and they were still putting you up in the chair. As hard as we all try, I've worked in the hospital on and off for years, but as hard as everyone tries to keep your head upright and in the middle, when you're really sleepy, it's really hard. And a lot of times, unless someone's there holding your head will kind of drop to one side or drop forward. And you might have spent some prolonged periods of time in that position. So of course your neck muscles are going to be really tight as well. Primarily the muscles on the neck and usually muscles on one side of your neck as well. So definitely probably all the stretches that we're going to go over today you will probably benefit from, and actually doing them is probably going to help a lot in some of the shoulder exercises that we've gone over in other videos. One other reason why your neck muscles might be tight that I'm not really going to get into a whole lot of depth on, because I have a whole video planned on this topic, is if you are an upper respiratory breather. So there's a lot that goes into that. That's why I'm making a whole separate video for that. But basically some people, if they're not using the correct breathing muscles, they'll use their neck muscles to actually lift the ribs up, which pulls more air into the lungs. But I'm going to do a whole video on that, like I said. But that's another reason why all of your neck muscles may become tight, and another reason why you would benefit from the stretches that we're going to go through today. So long story short, if you fit into any of those categories, most likely you do have some neck tightness, and you probably have that sensation where you just feel like you need a massage, or you have some little trigger points or little knots along the back of the shoulder. And most of that comes from shortened neck muscles. So we're going to go over the stretches right now. Super duper important, whether you are just having pain and you want to relieve some of your neck pain, or you're trying to regain movement in your shoulder. Having muscles that are balanced around your neck is super duper important. So let's dive into some of those neck muscles and how you would stretch those. Any of these stretches make you dizzy or lightheaded, you need to stop immediately. So if any of these neck stretches make you dizzy or lightheaded, do not do them. So the first stretch we're going to do is for the neck flexors and the side bending, or what they call like lateral flexors. And this is primarily to stretch that SCM, or that sternocleidomastoid that I had mentioned, and the scalenes, which are some deeper neck muscles in the front. So what you're going to do for this stretch is you are going to tip your head back and side bend. So tip your head back and to the side. Some of you might want to do this laying down. It just helps those muscles to relax a little bit more, and you might get a little bit of a better stretch. So basically you just take a little roll for this one, and you would just put it right underneath your neck so that you get a little bit of that neck extension, and then you're just going to pull your head to the side. And then of course it would be the same movement if you were sitting up, but again, you just might be able to relax a little bit more if you do this one laying down. So the next one we're going to do is to stretch the neck extensors, or the muscles that tilt the head back. Now, real quick, believe it or not, even if you have a forward head, a lot of times these muscles that tilt the head back are tight. And the reason is when your head is forward or drop forward because maybe you have some tightness on the front, what the body naturally does is lifts the head up to basically be able to see your environment. So the neck extensors, even though your head seems like it's forward, they might be tight. So everyone should really do this stretch as well. But for this stretch, we're going to be stretching a lot of muscles that I talk a lot about. The levator scapula and the upper trapezius are the two that I talk a lot about. And then there's a lot of other deep muscles in the neck that you'll also be stretching with this. But you're basically just going to tip your head forward. Now, the trick to this one is to make sure you tuck your chin in first. So you're actually going to tuck your chin back. So if you put your finger right on your chin, you're going to push your chin back, and then you are going to tip your head forward. Now, the other thing that you want to make sure is that you're not rounding your shoulders forward. So you almost want to kind of make sure your shoulders stay down into the back. When you do this stretch, again, that'll just deepen the stretch on those muscles just a little bit more and really isolate the stretch to those muscles a little bit more. Now, this next stretch is kind of like a side bend with rotation, and this is going to really isolate that levator scapula. I talk a lot about that, and when I go over exercises for the shoulder, that it's a big culprit or usually tight on people and becomes like a barrier to getting shoulder movement back. So I prefer to do this one laying down. So I'm going to show it laying down, but you're basically going to rotate your head to the side and then kind of bring your nose down towards that opposite hip. Again, to deepen this stretch, you can reach your hand up. Now, for most of you, you're going to be stretching the side where the arm is weak. So you will be able to lift your arm up, because this should be your strong arm. Lift your arm up to give a little extra pull on your head to deepen that stretch on that levator just a little bit more. And you're going to hold that for at least 30 seconds. Now, this next stretch is a side bending stretch. So again, I would do this one laying down. You want to really relax your head. Try not to use a pillow because you want your spine kind of straight, and a pillow will put you in a little bit of flexion. And you're just going to pull your ear towards your shoulder. You're really stretching the opposite side. Again, this is another one I like laying down because it just allows your muscles to relax a little bit more. Now, if you can, really pay attention that your other shoulder isn't coming along with the motion and going up as you rotate your head to the side. So almost feel like you're gonna kind of lengthen that arm, like you're gonna reach for your foot with the arm that's not on your head. And again, hold it for 30 seconds, but that is side bending. That's gonna stretch your upper trap and your SCM, or your sternocleidomastoid, and a little bit of your scalene muscles. For this next stretch, we're gonna stretch the muscles on the front of the neck. So for those of you that had that trach that I had mentioned earlier, these muscles will become extremely tight. This stretches a bunch of muscles that flex the head forward, but my favorite one to say is the platysma, one of my favorite muscles in school just because I loved saying it. But you're just gonna, again, I would do this one laying down. You're just gonna put a roll underneath your head. Again, I've said it, I can't say it enough during these stretches. If any of them make you dizzy or lightheaded, do not do them. You could be compromising blood flow to your brain, and that is not good. So if they cause any kind of dizziness or lightheadedness, do not do it and get out of that position as ASAP. But you're gonna put a little roll underneath your neck and you're just gonna let your head fall backwards. Now, some of these muscles also open the jaw. You might have a tendency to open your mouth when you do these. To really deepen the stretch or get the most out of the stretch, you really want to keep your mouth shut. So teeth touching teeth. And that is it for the stretches. I hope you all enjoyed this video today. I think it's a very appropriate tutorial for pretty much everyone. So definitely go ahead and share this video with your friends, family members. These are just good muscles just to de-stress. So hopefully you will share this video. I hope you all enjoyed it. Keep the comments coming. I have a little bit of free time right now, so I'm adding in some bonus videos. So definitely leave those in the comments. If it is something short, like you just want to know how to stretch like one specific muscle, put hashtag microtip Monday, because that would be a great video for a little mini micro tip, which is something that I just started last week. So if it's just that you want to know how to stretch one specific muscle, or you know, something really very specific, definitely hashtag microtip Monday. But as usual, I enjoyed spending time with you all today. I hope you have a wonderful day, and I will see you in the next video.